Are biopsy tools covered by insurance during a colonoscopy? Have you ever wondered if the tools used for biopsies during a colonoscopy are covered by insurance? When you undergo a colonoscopy, doctors often use biopsy tools to collect tissue samples from the colon. This is done to check for any abnormalities, such as precancerous polyps or cancer. The tools used are specialized forceps designed for safe and efficient sampling, and some even have features to help reduce bleeding. Now, let's talk about insurance coverage. Generally, the biopsy tools used during a colonoscopy are considered part of the overall procedure. Most health insurance plans, including Medicare, typically cover medically necessary colonoscopies. This includes the use of biopsy instruments when tissue sampling is required. Biopsies are crucial for diagnosing issues related to colon health, including colon cancer. However, the specifics of coverage can vary based on several factors. For instance, if a colonoscopy is performed as a routine screening for someone at average risk and no biopsy or polyp removal is needed, the insurance usually covers the procedure fully. But if a biopsy or polyp removal is performed during the colonoscopy, some insurance plans might classify these actions as therapeutic or diagnostic interventions. This could lead to additional costs or different coverage terms. It's also important to note that some insurance policies may require prior authorization or referrals for coverage of biopsies during a colonoscopy. In private insurance situations, such as in places like Hong Kong, additional treatments during a colonoscopy, including biopsies, might incur extra fees. However, comprehensive insurance plans can cover these costs to help minimize out-of-pocket expenses. Medicare and many private insurers recognize the significance of biopsies in monitoring and diagnosing colon cancer. Therefore, coverage is often provided accordingly. It is always a good idea for patients to check with their insurance provider beforehand. This way, they can understand the specifics of their coverage, any potential co-payments, and requirements for referrals or pre-authorization. In summary, biopsy tools used during a colonoscopy are generally covered by insurance as part of the procedure when they are medically indicated. This is particularly true in the context of colon health and cancer screening. To avoid any unexpected costs, patients should verify the details of their individual insurance policies.